As we do get started, as you probably knew coming in, we're going to be talking about health care in retirement. We're going to be talking about that whether it's Medicare eligible after you're 65. We're also going to touch base briefly on what it means if you're an early retiree and what you might do between the time you retire and the time you become eligible for Medicare. Many of you may not know, though, who I am and why I'm the one up here in the front of the room talking to you. My name is Joshua Haberman. I run a company called Medicare Insurance Professionals. That's been our specialty since that company was founded in 2012. Prior to that, I started practicing in health insurance and Medicare back in 2009. So I've been doing this for about 5 years now, and this is all we do at Medicare Insurance Professionals. The reason I'm here at Summit Investment Advisors is they recognize how important this particular piece of the plan is to the overall big picture. And so for the last year and a half, we have partnered with Summit Investment Advisors both to help their clients and to help people in the general population who have questions about Medicare and about health insurance because it is such an important part of everyone's plan. I guess the last couple things I would say in terms of introductory remarks are when we do advising for people, it's objective and it's comprehensive. In this room, there are some very specific rules about what I can and cannot tell you because all Medicare seminars are regulated by CMS. So either I can do a sales presentation, in which case I can really push and tell you everything you could ever want to know about a particular plan and a particular company, or I can do an educational seminar. This being an educational seminar, I have to flirt around the edges of naming companies and prices and benefits. You'll certainly get a very good idea of what's going on out there. I'm not going to dive deep because if one of you happens to be from CMS or the Department of Commerce here in the state of Minnesota, that's a good way for me to lose my license. Okay? So I'm going to try to respect those rules. That being said, if you do have any question about a particular company, a particular policy, I can answer that. It'll just be outside of the context of this particular formal event. Let's see, if any of you don't already know, the bathrooms are through these doors. I think I should be done before any of you need to use that, but they are there. There's obviously more food and water in the back. You're welcome to ask questions as we go through. There's a tendency during the presentation for me to tell you it's coming up in 2 slides. That doesn't mean you can't or shouldn't ask your question when you think of it. Just recognize in a lot of cases I will postpone answering your question because it is going to come up. There'll also be time at the end for you to ask additional questions. Those may be more specific than the ones you asked before. And I also, to kind of encourage you guys to pay attention, we both do a prize drawing and a trivia drawing. We have some crossword puzzle books and some Sudokus and some different things. And if you've been taking good notes throughout, you may walk away with something fun to do in the afternoon or on the weekend. Okay, any other questions before we get started? Yes?
Yeah, there was one other thing I was hoping you might be able to cover. That's when we retire and we decide to move outside the state.
Mm-hmm.
How extreme a difference are we going to find?
Absolutely, we will talk about that. That is an important topic, definitely. Okay, so let's get started. Today we're going to talk about how to deal with healthcare expenses in retirement. There are a number of different things on that agenda. We're going to get a lot of insight into healthcare expenses, okay? Before you turn 65 and after you turn 65, what it costs. We're going to talk specifically about the main way that almost everyone over 65 gets their health insurance, and that's Medicare. That will be a very large part of what we do this evening. We'll also talk about 4 different steps you can take to prepare yourself for that transition. That's kind of at a high level the main agenda we're dealing with here. And the reason this has become so important is illustrated very clearly on this chart, right? Overall, inflation is something real. You've all experienced it. This is basically my lifetime. I'm a little bit older than that, but not much, right? And healthcare expenses have been double the rest of inflation. Any of you remember what the cost of a postage stamp was back in '84? Nobody. They were about, not quite that low, but it was pretty low. They were, I think they were 19 cents when I was born in '81. So they were 2021 in '81. And you don't have to go back very far for them to be 5 cents, right? It's a tremendous, and that's exactly the same service, right? Getting a letter from point A to point B. It's not like that's different than it was before. And that has significantly more than doubled. So this is a very legitimate number, right? And to have healthcare going up at double that rate, I sure hope your investments are performing that well. Because we've got to have some way to pay for this very big cost. Well, what's causing that to happen? There are a number of different things that are causing that to happen. The first one is we as Americans use a lot more healthcare services as we get older, right? Probably all remember being young, having families, doing stuff. Maybe what happened? Somebody broke a leg, had a child, maybe you had a minor surgery, gallbladder out, I don't know. But you didn't do a lot before. And maybe you're still very healthy. Maybe we've got a triathlete in the room. Any triathletes? Okay. Well, many of you are probably still very healthy, right? You're not using up, but you probably have neighbors, friends who have had a heart attack already in their 50s or 60s, who've had a stroke already in their 50s or their 60s, who are dealing with cancer already in their 50s and 60s. And as we get older, that is the #1 driver. And as probably all of you are part of that baby boom generation, you're a very large group of people that are having major impacts on these costs because there's so many of you, right? There's just a lot of you. And here's a specific example. Knee replacements over the last decade have gone up 70%. And that's an extraordinary increase in price. Diagnostic testing, when Medicare came out in 1965, a lot of these tests didn't exist. And now they're routine for diagnosing a lot of different conditions. So using a lot more of that drives up Medicare costs. And prescriptions, whether they're brand name or generic, doctors are telling people to take a lot more drugs than they ever did in the past. And that drives up healthcare costs. That's why it's quadrupled since '84, even though inflation has only caused things to double. What that means is that healthcare is probably going to be in the top 3 expenses that you have in retirement. If I were to retire today, healthcare is already larger than my mortgage. Now, I'm probably not as successful as some of you are, right? So my mortgage is only like $525, and then I got taxes and insurance and stuff on top of that, right? But my wife and I already spend that much money a month on health insurance. And for many of you, in a very different situation, you may be spending very, very little on health insurance if you're still working. Your employer might be picking up 90% or even 100% of that bill. That will not be the case when you go on Medicare. And you may go from paying $50 or $100 a month or a couple $100 a month to paying several hundred or $500 or $1,000 a month. And that's an enormous, enormous change for your budget, and you need to be ready for that. How much overall can you expect Medicare to help you out? Medicare, on average, for people, covers about 60% of their health care bills in retirement. Somehow, there's another 40% sitting out there that you're going to be responsible for. When we ask people, how much do you think you'll spend in retirement on health care? They say, well, per year or over the rest of my life. And we tell them, give us your guess for the rest of your life. And maybe $80,000, $100,000. $125,000. On average, they're off by 50% because a real number for a couple is closer to $250,000. We'll show you how we get to that $250,000 number and why I think it's actually way too small. Okay? So really, there are 2 drivers of your healthcare costs in retirement. The first driver is personal factors, things like when you retire. If you retire at 50, you're going to spend a lot more on health care for 2 reasons. Number 1, you're in retirement for a lot longer. And number 2, the health care costs can actually be larger for some people before they retire, well, before they turn 65 than afterwards because of the way the laws are written today and because of the implicit subsidy that exists in Medicare. Your kids and grandkids are going to be paying taxes for your health insurance. You've been paying it for your parents and grandparents. And so that age at retirement can make a big difference. For all of you that are very healthy in this room, if you live 20 or 30 or 40 years instead of 5 years or 10 years, that's going to seriously jack up your costs and mean that more planning needs to be done. And of course, your general health. If you are healthy today and you can stay that way, your costs are going to be significantly below the projections we have here. On the other hand, I have people every year who run up bills in excess of that average number, that 220 that I showed you. So something that you want to think about. The other one is, how much of this risk do you want to take on yourself, and how much do you want someone else to take for you? It's not necessary for you to protect everything 100%. On the other hand, can you afford to take the risk of not protecting any of it? And most people will find that somewhere in between is the best fit. But we're going to talk to you about what your options are between 100% kind of Cadillac coverage and something much more Spartan, but may work very well for many of you. Okay? The plan that we're going to put together, the sort of tools we're going to give you, first of all, is what is Medicare? What does it cover? What does it not cover? What does it cost? Okay. We are also going to talk about your funding sources and how building a plan can help you prepare for all of these things. These are steps you can take right now, and you're taking the first couple steps right here this afternoon. Okay, so what is Medicare itself? Many of you probably already know that Medicare comes in different parts that have letters with them. Medicare A and B, that's what's on your Medicare card. If you don't have one yet, you probably have seen your parents' Medicare card, right, visiting them in a clinic or a hospital. Medicare Part D is much newer. That came out in 2006. A and B was 1965. Medigap is designed to pay things that original Medicare A and B didn't. We'll talk a lot about that. Medicare Advantage, 1996. That came out as an attempt to privatize Medicare, hopefully to save money, and it's a way that many people get their Medicare coverage today. Okay, so what we're going to talk about now is how you actually get Medicare, okay? In terms of getting Medicare, you have 3 different opportunities to get into this system. The first one is called your initial enrollment period. Your initial enrollment period occurs 7 months around your 65th birthday. So 3 months before you turn 65, the month you turn 65, and the 3 months after that, okay? So the other thing you should know is Medicare always starts on the first of the month. So if your birthday is July 15th, your Medicare will start July 1st. Is there anyone in here with a birthday on the first of the month? We've got one. So you're the exception, right? Normally, it starts on the first day of the month you turn 65. For you, Mike, it's going to be the first of the previous month. So if your birthday's in July, your Medicare is actually going to start June 1st, 1 month earlier. And of course, that moves your initial enrollment period, okay? That's when most people get enrolled in Medicare. That's the simplest and the easiest. If you're already taking Social Security, when you turn 65, you'll receive your card automatically in the mail. There's nothing you need to do. For some reason, approximately 1% of these cards don't show up. Okay, that is a problem. And so what I tell people is if you're already drawing Social Security and you don't have your Medicare card 60 days, 2 months before you're going to turn 65, you need to start making some phone calls, because everybody expects you to have Medicare when you turn 65, and if you don't, it could mess up your other health insurance coverage. And we'll talk more about how that can happen later, but that can be a very big deal, okay? The second way that you can sign up for Medicare is during what's called a special enrollment period. Some of you either are or plan to work past 65, or maybe you have a spouse who will do that. You may not need to enroll in Medicare right away when you turn 65. You may have great plans for an employer who's paying most of the premium. There's no reason for you to do this, okay? You're permitted to postpone Medicare and not be penalized as long as you have creditable coverage through your own employer while you're actively employed, or your spouse's employment while they are actively employed, okay? The penalty, if you miss this, is 10% for every year that you're late, and you pay it for twice as long as you were late. And that's on Medicare Part B, okay? Medicare Part D, if you miss it, the penalty is 1% per month that you were late for the rest of your life. Medicare Part D came out in 2006. I have met people who didn't take it out then, haven't taken it out yet. Should they decide to take it out, their penalty could be 3 times as large as the premium on their plan. And they're going to spend in penalties very quickly what they saved in premiums over those last couple years, unless they can stay out altogether for the rest of their lives. So they really want everybody to participate. Those penalties can be punitive. I want you to be aware of that. The third opportunity you have to enroll in Medicare is during the general election period. The general election period runs from January 1st through March 31st, and it's for people who missed their initial enrollment period or their special enrollment period. And this is where I want to tell a story that's very important. It's illustrative of the importance of getting good advice and what can happen if you miss these deadlines. A couple years ago, in July, a client in my office came to his financial advisor. He had been 65 for a while. His wife had been working at a large bank here in town, and she had been laid off. When she was laid off, she was offered COBRA, and the company was going to pay the entire COBRA premium. So they were like, sweet, life is good. Now remember, I said the husband was already 65. He was 65 while she was still working. It was okay that he didn't enroll then, right? He had a spouse who was working, he had creditable coverage, life was good. But when she was laid off and was no longer working, he had a 63-day window to enroll in Medicare, and he did not. And so the first thing he's going to have to deal with is he's late, he's going to pay a penalty. But it's worse than that, right? He came to that other advisor in July. Advisor didn't deal a lot with health insurance, so he came to me. He's not even eligible to enroll in Medicare until the general enrollment period. He's got to wait, it's August, he's got to wait August, September, October, November, December before he can enroll January 1st. But his Medicare doesn't start January 1st. His Medicare starts July 1st. He has an 11-month wait before that coverage will kick in, and his COBRA would expire at the end of August. Now, for a healthy person, they might write that off as a whoops, but he had 2 stents in. He was on blood thinners and other prescriptions to kind of keep his heart functioning. And it was not something that they were very comfortable being without insurance. But it's also extraordinarily hard to get insurance after you're 65 if you don't have Medicare, because everybody expects you to have Medicare, and so everything you'd buy supplements Medicare. Well, if you don't have Medicare, there's nothing to supplement, so you can't even buy the other products, right? So these dates are incredibly important. Good news is the guy did not die over those 11 months, nor did he have a catastrophic heart attack or something else, right? But he was going to basically be responsible for 100% of his bills for that 11-month window. And I don't want any of you to be in that position, because that can make a $250,000 lifetime cost look like a drop in the bucket. I mean, if he had had a heart attack or a stroke or developed some other thing during that time window with no insurance, that would have been painful. And they thought they were covered because they had COBRA and their employer, the wife's employer, was paying the entire premium for it. So watch out for that stuff. If you have questions, if you're retiring, if your spouse is retiring, if you're turning 65, call somebody and ask those questions. Yes?
Is there a fee associated with any of these?
Like premium-wise?
Yeah.
Yes, and we'll cover that
Okay.
in a few slides. Any other questions right now where we're at? Okay. Also, for those of you who have been reading the slide in addition to listening to me, you'll see that this makes note of the annual enrollment period. So after you initially enroll, every year from October 15th through December 7th, you're given an opportunity to change your plan. And for most people, they don't want to change their plan, but they want to check to make sure it's still competitive. Why? Because these rates go up every year. The plans may change their benefits, and your particular health situation could change. Maybe you're on a different prescription or more prescriptions. Maybe your doctor changed. Maybe you moved. Maybe a number of things changed. So reviewing your plan annually is a good idea, whether you make a change or not. Okay, so what does Medicare Part A cover, and what does it cost? Part A is the nice part, right? It costs $0. Everybody likes 0, and with any luck, it'll stay that way. In addition, it covers what for many people is what they feel like is going to be the biggest risk if I'm hospitalized, if I have to spend a day or a week or a month in the hospital. For that time, up to 60 days, you have just a small deductible of about $1,200. That's the 2013 numbers. It's currently $1,216. So it's gone up a little bit. Okay? Note that that covers 60 days of coverage. If you're able to go home and you're healthy for a while and you come back, you could have to pay that deductible again. In fact, you could have to pay that deductible up to 6 times over the course of a year, because it's a deductible per benefit period, not per calendar year. So we want you to be aware of that, okay? The second thing we want you to be aware of is that's for hospital room and board. That is not for the services you receive while you're in the hospital. Your surgeon, your anesthesiologist, the testing they may be doing on you, that's all going to be covered separately by Part B, which we'll talk about in a moment. Now, most hospital stays aren't that long. But if your hospital stay is more than 60 days, you can see that there's a daily copay of about $300 a day. Anyone want to do the math on 30 days times $300? It's about $9 grand. That would be an expensive month. Most people don't make $9 grand a month. And spending it in the hospital would be a bad way to spend it. If you're in there beyond 90 days, it doubles in cost. So now it's 18 grand a month for up to 2 months. And if for some unfortunate reason you're in there beyond 150 days, Medicare Part A turns off. Now that's pretty rare, right? That's not normal for people to be in the hospital that long. But I want you to know how it works, because some of you may run into a family member or someone else who's dealing with that, and you got to make some tough decisions around day 148, 149. What are we going to do? Because eating 100% of that cost yourself may not be practical. That may be the end of the farm.
I'm a little over 65 and I'm still working.
Mhm.
I have insurance through my company. My Medicare card right now is just Part A.
Mhm.
If I do have to go to the hospital, who is primary, who's secondary, how does that cover?
So the basic rule is this. If your employer has more than 20 employees, the employer plan is primary, Medicare is secondary. So your employer plan is going to pay first. Having Medicare Part A may help you out though if your plan has a large deductible. Okay, say your plan has a $3,000 deductible on it, 100% coverage after that, but you're responsible for the first 3 grand. Well, actually, when you get to the Medicare Part A deductible, Medicare will kick in. So you'd pay, say, the $1,184, or actually $1,216, and then Medicare would pay from there to $3,000, and then your plan would pay everything over $3,000. Now, if your company was under 20 employees, your company's plan would be secondary. Medicare would have to pay first, and then you wouldn't want to have just A, because if you did in that situation, you'd have an enormous gap for all the non-hospital bills. Okay, so what you're doing, I'm guessing your employer has more than 20 employees. Yeah, so what you're doing is almost certainly perfectly fine and a good idea. But if we have anyone in here who works for a smaller employer, different rules for you, right? You got to take action when you turn 65 because Medicare will be primary to your group insurance. Okay.
Just want to clarify something. If you go into the hospital
Mhm.
6 times, like currently my wife's going through bone marrow
Yep.
transplant and in and out of the clinic and
Mhm.
hospital, you pay that deductible each time.
Yes,
Although because
but they're benefit periods. And so what happens is Medicare will cover up to 60 days at a time. Say she's in for 3 days, she's out for a week, and then she comes back. She hasn't actually been out long enough to trigger the second benefit period. She actually goes back in and picks up where she left off. So if she was in for 3 days, she was out for a week, she comes back on day 4. Now if she's out for 2 months, if she's out for 60 days, then she starts back over at day 1. So it depends kind of how frequently she's going in there and how big the gaps are. But if you're just in there for 1 or 2 days at a time and then out for 2 months, you could run that deductible 6 times in a year. Yes?
So what's the gap, what's the time period that it doesn't count as a new event?
So you have to be out of the hospital, not hospitalized for 60 days to trigger a new benefit period. If you're readmitted in less than 60 days, they just pick up where you left off, which is also an easy way to go from day 60 to 61, right? Say you were at 59 or 60 when you got discharged and you weren't able to stay out 2 months. Now you're starting out at day 61 instead of starting back over at 0. And so some people run into a dilemma. Oh my God, I need to go back to the hospital, but I really need to wait till tomorrow or Tuesday, so that I can start over at 0 because I don't have a grand. That's an awkward place to be. Yes?
How long has this particular Medicare Part A, B, and whatever criteria been in place, and has it changed from decade to decade?
So it's been in
So if
place
we're
since
gonna take
60.
advantage of it for maybe another 10 years or so, do you foresee that the whole plan and rules will change?
Not drastically. You guys are all fortunate enough to be old enough to be pretty well connected politically, and your benefits are pretty well protected. No promises for my generation or your kids, right? But you guys are sitting in a pretty good place. Have they made changes to this? Yes, absolutely. They changed the deductibles. They recently added a bunch of preventative care that's now covered that wasn't covered before. They can certainly make those changes. They fiddle around with things called observation stays. Some of you may have heard some scandal about that. So there are things that happened around the edges, but the core benefits have been the same, and I expect them to remain the same. Okay, so that's Medicare Part A. No premium, moderate size deductible, big daily copays if you're in there for a long time. Medicare Part B, this is what people pay for, so this is usually the first thing that gets people excited, right? The standard premium is $104.90 a month. I'm going to refer to it as $105 going forward, okay? This comes out of your Social Security check if you're taking one. If you're not, you either have to write a quarterly check to the Social Security Administration for this, or you can set up Easy Pay and then you can pay monthly out of a checking or savings account. If your income is very low, you may pay less than this. If your income is considered high, you may pay more than this. The more is based on something called an income-related monthly adjustment amount. It starts for single people at $85,000 a year and couples at $170,000 a year. So if your income is above that level, you may be subject to paying those. The other thing you need to be aware of there is they're basing this on your tax records. So they may not have this year's tax records or even last year's. So they're basing it on taxes from 2 years ago. So if you sold a business or you had some other windfall or whatever 2 years ago, you may be paying an income-related monthly adjustment amount even though your current income is lower. So be aware of that. Those income-related monthly adjustments could, if your income is high enough, increase that premium from $105 a month to about $335 a month. So if you're a couple, instead of paying $210 for Medicare Part B, $670 a month for Medicare Part B. So if you're in that higher income class, okay, and that higher income class for singles I think starts at $218, and for couples twice that, so $436 or something like that, okay. There is a small calendar year deductible associated with Medicare Part B. It's $147, and most of the coverage is 80-20. Medicare is going to pay 80%, you're going to pay the other 20%. The thing that you don't see on this slide is an out-of-pocket max. So if the bill's $100, most of you probably won't sweat having to pay $20. If the bill's $100,000, most people don't enjoy writing $20,000 checks for medical care. And so that's probably the #1 biggest driver for why somebody would want something else, whether it's a retiree plan, a supplement, an advantage plan, a cost plan, whatever, okay, because that 20% is uncapped. The other thing that's not on this slide but is very important to you is doctors are allowed to charge something called excess charges. So when I say Medicare pays 80% and you pay 20%, that's of the Medicare approved amount. And if the doctor says, you know, that isn't enough, I can't run a business on that, that's ridiculous, and they choose to charge more than that, you're responsible for 100% of that additional charge, which can be an additional 15%. Okay? Now here in Minnesota, you're protected from that by state law. But if some of you have second homes somewhere else, or you like to travel out, or you just want to get your medical care somewhere else, you could be subject to those excess charges. And that's something you want to build into your plan and how you're going to pay for it. Okay? Okay, prescription drug coverage. For many people, this is the most confusing part of Medicare. Why is it confusing? Because there are so many different plans and options. And even though the base benefits are standardized, there are just so many variations on it that it can be quite confusing. Here in Minnesota, we have 49 different prescription drug plans. Different premiums, different copays, different deductibles, different coinsurance. And they're all really providing the same benefit, right? Simvastatin, 20 milligrams once a day. And it's going to be the same whether you get it at CVS or Walgreens or Target or Costco or wherever you, or mail order, right? It's the same drug in the same bottle doing the same thing in your body. So choosing the right plan makes a big difference. What I'm going to cover here on the screen is the standard benefit. All plans must be at least this good. Some of them will be better. In order for you to figure out what the best plan for you is, we recommend you get your list of prescriptions together in one place, what your favorite pharmacy is, and have someone run them. They can run them through all 49 plans, and they can get back to you a recommendation. Here's the list of all the plans and what they all cost. Most people buy the cheap one. Because again, simvastatin is simvastatin, lisinopril is lisinopril, levothyroxine is levothyroxine. So the maximum deductible they could charge in 2013 was $325. Some plans waive that or reduce it. After the deductible, and that's a calendar year deductible, the plan is expected to pay 75% of your bills, and you're expected to pay the other 25%. There are very few plans, however, that actually design their plan that way. What they actually do is they give you a copay. Your generic's going to be $10. So if your generic is 12, you're paying a lot more than 25%. And if your generic is 100, you're paying a lot less than 25%. And the way the plans get away with that is, on average, they pay 75%. And that's why it's very important for you to run your prescriptions through each of the plans, because some plans may feel like they were custom designed for you. And other plans may be or feel like they are out to get you. Man, they're picking on that one prescription that you have. They just got a crazy, crazy copay for it. Right? So you want to be able to compare those plans to find the one that's really best for your particular situation.
What's the range of premiums?
Right now, the range is from like $12.60 to $200 a month. It's a big range. National average is about $35 a month. And that national average is what the penalty is calculated on if you're late. It's not based on your particular plan, which could cost a lot more or a lot less than that. And that's how it's very easy for people to end up in plans where the penalties are far larger than their plan premiums, even if they're only a little bit late.
What was the national average again?
About $35. I think if we get a number on here, it'll probably be like $32.40, but that's already a year or two old. If you get through about $3,000, it's actually $28.50 right now, but if you get to that level of spending between your deductible, what you paid, and what the insurance company paid on your behalf, you get into what's called the donut hole or the coverage gap. In this period, historically, you've been responsible for 100% of your drug costs, and this affects about 13% of Medicare beneficiaries. They're actually in the process right now of closing the donut hole. Turned out people who are on Medicare don't like the donut hole. Imagine that. Okay? And so by 2020, the donut hole is going to be gone, and it's going to look like this all the way up, right? 75% by the insurance company, 25% by you. Right now, what that means is if you have a generic drug, you pay 72% instead of 100%. And if you have a brand name drug, you pay 47.5% instead of 100%. And each year, those get compressed down a little bit so that, like I said, by 2020, it'll be 75, 25 all the way up. Well, all the way up to where? Well, actually, you come out of the donut hole at about $5,000. It's actually $65.50 or something like that, but your portion is $47.50, and currently you're being protected from 50% of the brand name drugs in the donut hole. So your total exposure is probably more like $2,500, maybe $3,000, depending on your particular mix of drugs, but your total spending will be around $6,500. Again, that's the 2013 number. I think we're at $6,550 right now in 2014. At that point, your plan is going to be covering 95% of your drugs costs, and you're capped at 5%. Although in many cases, you'll just pay a very small copay of $265 or $660. All of that being said, there are a lot of things that Medicare doesn't cover, right? Doesn't cover the Part A deductible, doesn't cover your daily copays, there's the 20% co-insurance that you're responsible for. How do you get coverage for those things if you want it? There are three ways. We're going to talk about them. The first one is a traditional Medicare supplement. These have been around since 1965 when Medicare came out. These plans are standardized on a national basis. In fact, if you talk to your friends out of state, they'll tell you letters. Did you get Plan F? Did you get Plan G? Did you get Plan N? Did you get Plan K? Right? We've lettered them in 47 of the states. You happen to have chosen to live in one of the three that are funky. Okay, Minnesota, Wisconsin, and Massachusetts are different. You know, we're special. Everybody's above average. And so here we have a basic plan plus 4 riders. You can recreate all those lettered plans. So you can get whatever letter you want, but it's not going to have a letter. It's going to be basic plus rider 1, basic plus rider 1 and 2, basic plus rider 1 and 3, whatever. You combine them however you want. If you want comprehensive coverage in the rest of the country, it's called Plan F. Here in Minnesota, it's the basic plan plus all 4 riders. You can get that same plan, it's just we just label it a little bit differently. Okay? If you do that, you got no network. Every doctor who accepts Medicare must by law accept your plan. That's kind of cool. Your benefits are guaranteed renewable, meaning the plan can't reduce or modify your benefits because they don't like you or they don't like the group of people that they have on their plan. The plan is portable, so if you decide to retire to some warmer state, and I would really like to do that right about now, you can do that. You can take your plan with you. None of these plans cover prescription drug coverage, so you're going to have a separate standalone plan for that. Of those 49 plans that we talked about before, 32 of them are standalone, so you still got a lot of choices. Okay? The other thing that I wanted to make sure I emphasize here is all these plans are identical. So if you choose to buy a Medicare supplement, you're making your decision based on two factors: the name on the card and the price. Those are the only two things that are different, because everything else by law is identical. There's a huge range in these costs. You can get these for about $200 a month. You can spend over $500 a month on these. And I'll tell you a brief story about why that is. I'll try to keep it brief. Basically, these are like ships. And as long as they're at port, they can't sink. What does being at port mean? Being at port means they're taking on new clients. Okay, as long as they're taking on new clients, there's new fresh blood in there, they'll be able to pay for the people who are older and sicker. But as soon as they stop taking on new clients, right, then whoever's left, they got to pay all the bills. And what happens to people every year? They get older. And they probably get sicker. And if they're not taking on new clients anymore, that premium skyrockets. That's how you get a range from $200 to over $500 a month. Because some of those plans, nobody's going to buy a new plan for $500 when they could buy another one for $200. That plan is effectively closed off. It's left port. And it's going to basically sink. It's just a question of how long people are willing to pay those premiums before they give up. And so if you choose a plan, the only reason that I think you care about the name is whether or not you think they're going to be able to keep their premiums low enough, long enough, for it to not leave port before you do. That was a bad joke. I apologize for that. We'll try a better one later. Okay. The last thing on here is none of these supplements, which again are standardized, cover the benefits of hearing, dental, or vision. So if you want those things, you're going to have to get them somewhere else, either from a past employer, from a standalone plan, or self-insure on those. Okay, Medicare Advantage plan. Before I get to that, what's your question?
Well, when you mentioned they range from 200 to 500 a month per person?
Per person.
Per couple?
All Medicare plans are individual.
Okay.
Yep.
You said something about guaranteed renewable.
Yes.
If they renew every year, if you change plans and then come back, could you be blocked out of something?
So there are a couple of things there that I glossed over, right? So all these Medicare supplements, when you turn 65, are guaranteed issue, right? If you ask for these plans when you turn 65, they can't turn you down. If you delay taking Medicare B because you're working later, they're also guaranteed issue then, okay? If you leave some of these plans, some of them will give you a window, 6 months or 12 months to come back, no crime, no foul, right? No blood, no foul, that's how you say that, right? But if you're gone longer than that, they absolutely can ask medical questions. Why? Because they don't want the sick people. The only chance they got at keeping these plans low is to stick to the healthy people. They, by law, have to give it to everybody when they turn 65, but they figure you don't know if you're going to be sick yet. That's what they're hoping, right? And so everybody will sign up. We'll get some sick ones, but we'll get enough healthy people to make up for it. After you get past that period, they only want healthy people. So better start training for the triathlon. Yes?
So you could be blocked out.
Absolutely.
All plans
Yep.
at some point.
Well, all traditional Medicare supplements. Because they can ask about your height and weight. They can ask about your blood pressure. They can ask about your cancer history. They can ask about anything they want. And if they don't like it, they can tell you no.
After 65?
After you initially, when you initially go on Medicare B, you have an opportunity to get these guaranteed issue. For most people, that's when they turn 65. For some people, because they or their spouse is working later, it gets delayed a year or two. But once you get past that window, you're going to be answering medical underwriting questions.
So if you've got a lot of medical problems,
Might be a good idea to start there.
we'll start, but stay put with the same.
Yeah. Yeah, because nobody else is going to take you at that point.
So that's why you want to choose a good one that will stay at port.
And it's not going to have the premiums explode on you because, I mean, to have your premiums go from $200 to $500 is kind of brutal for most people's budget, especially if there's two of you, right? You and your spouse, and you both have to. That's killer.
Even if I continue working, I should still sign up and pay the premium?
No. If you're still working, you still have the employer provided coverage. You haven't signed up in Part B yet. You don't have to worry about this until you stop working. You get Part B, then Part B is really your trigger. Yep. That make sense?
So I can
Well-
see right now already that
I'll get you a card. So I'm not exactly sure what your question is, but I can help you.
I just got notified that I can be on Medicare.
So my question, are you 65 or are you, okay, so,
I turned 61 and I've been out of work since 58.
so you've got something different going on. So when a person is disabled, after 24 months, you're eligible for Medicare. You can take it then or not take it there. You're going to get a second shot at 65. So even if you pass up on it when you're initially eligible at 61, say, you're going to get another shot of guaranteed issue everything when you turn 65. Maybe you should take Medicare now, maybe you should wait depending on the quality of your spouse's benefits, but you're definitely going to get another shot when you turn 65. Guaranteed issue.
So if I signed up for it now, I could have the supplement would be on there.
It could be, yep, you could do that, yep. And in cases like that, which are complicated cases, but can happen to the rest of you in the room, even if you're not disabled, right? Your spouse is still working. They can cover you through the employer plan. Somebody in here asked me this question. So say your company covers you 100%, but you have to pay whatever the premium is for your spouse. So maybe you're paying $500 a month for your spouse. It may actually be cheaper for your spouse to get Medicare and a supplement, or Medicare and Advantage plan, or Medicare and a cost plan, than it is for them to be on your group insurance, right? So there are cases where you may do that even though technically you're eligible for group insurance because it may be cheaper to do Medicare. Okay.
Regarding the Affordable Care Act.
Yep.
Where people who are not, 65 and above, supposedly are not being, denied health coverage because of pre-existing conditions. Is that not pertaining to people 65 and above?
So you have separate protections when you're 65 plus, right? First of all, Medicare is guaranteed issue to everybody. Everybody can get Medicare. When you turn 65, it's guaranteed issue to get in a Medigap plan. And the cost plans and the Advantage plans are also basically guaranteed issue. So you've been protected in those ways for a long, long, long time. So the new rules were really designed to impact people under 65.
Okay.
Yep. And I guess I'll throw out a quick comment there. For anyone who does decide to retire early, again, you want to look at not just any retiree health benefits you may have from your employer or spousal benefits. You may also want to look at health insurance available in the private marketplace or on MNsure, because depending on your income and how generous your employer or your spouse's employer is, you may find better coverage for a lower cost in the private market. That doesn't always happen, but it happens often enough that everybody should check it if they're going to retire early.
Again, even though I'm continuing to work, 3 months before I turn 65, I should still enroll
So
Medicare?
So if you're not participating in a health savings account at work, then I would enroll in Medicare Part A, which is free, because it will make the rest of your life easier.
Even though I'm still working.
Yep,
But Part B, hold that.
hold that off, yep. Yep, that would be the general. You stuck your question up early, or your hand up early, and I didn't know if I answered your question or I was glossing over you. Okay, you're okay? One more and then I'm gonna move on.
Back to the Medicare versus HSA.
Yep.
Is there a time boundary? Is it based on a year? Say halfway through the year, I'm paying HSA and then go on to Medicare? Would the HSA stop? My contribution stop at that point?
That's the key thing, right? Because you can still have an HSA. You can't contribute anymore once you go on Medicare.
Okay, so it's the contribution.
It's the contributions that stop. So get them all in before you go on Medicare for the full year.
If I made a maximum contribution,
Yeah,
okay, so it's not prorated.
that's correct.
Thanks.
That's great. You're welcome. Okay, so the second option that people have are the Advantage plans. Advantage plans are actually a lot more like insurance you may have had in the past, whether it's through an employer or an individual plan, right? They could be HMOs, health maintenance organizations. They could be PPOs, preferred provider organizations. They could be fee-for-service plans. They could be other special plans. But these plans are all going to be similar in that they have networks, they have deductibles, co-payments, co-insurance, and an out-of-pocket max. and they're going to be similar to other insurance you've had in the sense that they're bundled. Everything comes together in one package. Your original Medicare, your supplemental benefits, your Part D, your prescription drug benefits, and potentially even some hearing, dental, or vision. They have the ability to add in some of those extras for you, okay? It is very important if you have a plan like this that you check to make sure your doctors are in network. Your costs will be higher, in some cases significantly higher, if you go out of network. And I encourage my clients who have these kind of plans, not that they're bad plans, but to be consistent. Every time you go to the doctor or schedule an appointment, making sure, are you still accepting Medicare? Are you still accepting my plan? Because that is a nasty surprise. And I'm currently working through a dispute with a client who went into, not going to name the provider, a major provider here in the metro area to get a procedure that is routine preventative care, should be covered 100% by original Medicare. They shouldn't even need their supplement or their Advantage plan. And they went in to see the doctor, and the doctors there ordinarily and routinely accept Medicare. This doctor for this colonoscopy, I don't even accept Medicare. $3,000 bill for something that should have been zero because they didn't ask. Now we're disputing this and we think we're going to win, but that is the sort of thing that can happen. And the place where it most commonly gets people is you go into the hospital to have surgery, maybe you picked your surgeon, maybe you didn't pick your anesthesiologist. Okay, that kind of stuff happens to people. And it's very important that you're checking as best you can. Now, there are some things that will help you in those cases, but not get you to the 100% level, right? They may cover what they would have covered for, say, an in-network anesthesiologist because you didn't have a choice, but if that guy charges more than what an in-network guy would have charged, then you're responsible for the difference, right? So the network stuff is very important, and it's not that the network is bad. Some of these networks are covering 96, 97, 98% of doctors. So you're not losing much, but it is a big deal if you manage to find the one that isn't in network, okay? There isn't a slide for the cost plans, so I'm just going to talk about that out loud. In most of the country, these are your only two options, supplements and Advantage plans. Here in Minnesota, we have one other. Yes?
I just have a quick question. Do you have a feel for, because you work in the industry, somebody asked about consistency and
Yeah.
How the plans, will they change, that sort of thing. Do you have a feel for how the medical community will change going forward with changes in Medicare and what's covered and what's not, and what is being reimbursed?
Yeah.
So will there be more and more providers that opt out?
This is one of my favorite questions. I love to get this question. And what I will try to do is answer it in an unbiased fashion and not get into politics, okay? So currently, today, there are roughly, not quite, but close to 900,000 doctors. About 9,000 of them have opted out of Medicare. So about 99% of doctors are currently accepting Medicare. Aside from gynecologists and pediatricians, how old do you think most doctors' patients are? They're old. And how old do you think their really well-paying patients are, the ones with heart attacks and cancer and strokes and dementia and Alzheimer's and stuff? Old. These are Medicare people. If they don't take Medicare, they're out of business. So I don't think they're going to stop taking Medicare. Now, Medicare is seeing cuts. The Advantage plans are seeing cuts. There is a lot of stress being put on doctors. To be sure, there are lots of doctors who are tempted to drop out and are very frustrated by the system. But for most doctors, not taking Medicare is like not being a doctor. Because that's where the money is. That's where the clients are. That's where the diseases are. That's where the action is, right? And so they really have to participate with Medicare if they want to get paid. Right? And there are a few, and I'm going to be a little bit, I'm going to use some adjectives here. I'm going to say arrogant doctors who are, I am so good, you will come to me and pay me no matter what my charge is because I got the hands of, an angel, right? And so there are some doctors who will do that and only serve Medicare-type patients but not accept Medicare because they're like, you only come to me after 3 other guys have failed to treat your cancer. And if you're coming to me, you still got money left and you're willing to pay it. So I'm going to charge you $500,000 and it's going to be fair, right? And so there are doctors like that. But in my opinion, you're paying for hope and a dream there, right? Because if they were that good, right, Medicare would approve whatever it is they're doing and every other doctor would be doing it. It wouldn't be out on the fringe. Yes?
Is supplemental insurance consistent
No, either or.
That's what I was thinking.
Either or. They're mutually exclusive. It's illegal to have both. Was there another question up front? I don't want to gloss over you guys because sometimes I'm checking the back of the room. Okay. So cost plans. Cost plans are the third category currently available here in Minnesota. They're a hybrid between the Advantage plans and the Medigap plans. Like the Advantage plans, network, deductibles, coinsurance, copayments, out-of-pocket max. Unlike the Advantage plans where you're locked in 1 year at a time and you make your changes during the annual enrollment period, you can make changes to those cost plans at any time throughout the year. And your plan change takes effect the first of the next month. So a lot of people really like it for the flexibility. A lot of people also really like them because you can get benefits that look like, not are the same as, but look like the supplement plans for about half the premium. Good news, bad news. I think they're going away. Now, you may have heard people saying this for the last 14 years, and they would have been wrong because they're still here. The reason I think they're really going away now is all the providers of cost plans here in the state of Minnesota have recently come out with Advantage plans. You're not allowed to have an Advantage plan and a cost plan. And so basically, they're all creating Advantage plans to replace their cost plans, which tells me that they don't believe they're going to be able to successfully lobby Congress anymore to keep those plans around. I still think that the cost plans are a great plan. You just may only have it for a year or two longer. Right? The cool thing about having a cost plan, though, is if the plans go away, you basically bought yourselves 2 more years to decide whether or not you need a real Medicare supplement. Because when those plans go away, you're going to get a special enrollment period to get guaranteed issue any policy you want. So I think we will still see most people signing up in cost plans as long as they can, because they know if they do go away, and I think they will, they're getting a free look again to go anywhere they want. Okay, so that's kind of my quickie on the cost plans. Okay, so things that you're going to want to weigh out as you're doing this. Do you want the extras? Things like dental, vision, hearing, and so on. Things that aren't provided by original Medicare and aren't available with a traditional Medicare supplement. Because if you want those things, you're either going to have to get them standalone, pay out of pocket, or choose an Advantage or cost plan. Is it important for you to stick with your current physicians? Now, this question really has 2 parts, because if your current physician doesn't accept Medicare, there isn't a plan that's going to help you. Okay, so they have to accept Medicare. But assuming they do, and again, 99% of doctors accept Medicare, the network question doesn't apply to supplements. It applies very much to cost plans and Advantage plans. Now again, most of those plans are very large. You'd expect your doctor to be in, but you do want to check first. Estimate your total out-of-pocket costs. So if you have a Medicare supplement with all the riders and you go in for a procedure, how much do you pay? 0, because that's your 100% Cadillac coverage, right? If you go in with a cost plan or an Advantage plan, you may have a copay or co-insurance, and you definitely have that out-of-pocket max. So are you comfortable in a bad year spending $3,000 or $3,400 or $6,500? Because you're going to have to deal with that under a cost or an Advantage plan. Now, in most years, you might spend $100, you know, for a few copays, or $200, but you may also have that terrible year. And you have to be mentally prepared for that. You're getting premium savings on the front side, but you got to be prepared.
No,
Okay.
On the supplement plans, they only pay for what Medicare pays for. So if something's not covered in Medicare, it's not covered in this.
That is correct.
Is that true for the Advantage plans and the cash plans as well?
Well, for Advantage plans, they can choose to cover things that original Medicare doesn't. And that, for some people, is a big incentive to buy them. And I'll give you one of my favorite examples for this. In order to qualify for the skilled nursing facility benefit under Medicare Part A, which we didn't really talk a lot about, but that's, say you break your hip and you need some rehab before you can go home because you got stairs there, okay, and so you need a week or 2 weeks or something to do some rehab. Medicare will pay for that if you had a prior 3-day hospitalization. If you didn't have a prior 3-day hospitalization, Medicare won't pay. And what has happened to a lot of people, and this goes back to the observation stay that I mentioned very briefly earlier, right, is they're in the hospital for a day or two, and the doctor says, go home, you're doing fine. And they're like, no, I'm not doing fine, and I want to go to the skilled nursing facility for my rehab. I need to stay here because I need 3 days. And the doctor says, okay, you can stay. Doesn't mention that he's changing the coding from admitted to observation status. Well, if it's observation status, it doesn't count towards your 3 days. So then you're not getting coverage for your skilled nursing facility care. The Advantage plans can waive that requirement, and some of them do, so that you can go after only 1 day in the hospital or 2 days, or even after 0 days in the hospital to a skilled nursing facility for that kind of treatment. And so there are definitely places where people are like, Advantage plan is going to be way better for me than a traditional Medicare supplement. And so you got to weigh those things out. You know, what's more important to you? A Medicare supplement is really bound strictly by Medicare's rules. Advantage plans have more flexibility. They have to, have minimum payouts, but they can arrange those payouts however they want. And so they can be more generous in those ways. Does that help answer your question? There's always more. You can ask them later. Let's see here. Flexibility, choosing providers, again, that comes down to the network. A lot of times you'll find that your doctors are in your network with a cost for an Advantage plan. But if you don't want to worry about it and you don't want to have to ask every time, Medicare supplement is the way to go. Do you have protection from catastrophic illness, right? So in my opinion, all of them provide protection from catastrophic illness because you've gotten out-of-pocket max even on the cost and the Advantage plans. What you have to decide is, can you deal with a maximum out-of-pocket of $6,500 or $3,400 or $3,000? If you can't deal with that, maybe that's not the plan for you. Maybe you need to pay a little more every month to get a plan where you got zeros all the time. Okay, so remember before we told you that cost for a couple was about 220 grand? I want to show you how we get there. Medicare Part A, you pay nothing for. Okay, no premium, no cost there. Your supplement, if you choose a traditional Medicare supplement or even a cost for Advantage plan, will typically pick up your deductibles and your copays. Medicare Part B at $105 a month, $1,259 per year. Okay, Part D, premium, deductibles, copays, coinsurance for an average Medicare beneficiary is about $1,900 a year. Now you're all younger, so you might be a little bit lower than that, but maybe some of you in here are already taking a bunch of inhalers and some other expensive drugs, right? So that's an average number. Plan F, nationally, about $2,100 a year. Here in Minnesota, closer to $2,400 a year, okay? Altogether, you're looking at about $5 grand a year for an individual. For a couple, 10 grand a year. So if, as a couple, you live for 10 years, you're talking about 100 grand, a little bit more than that, right? If you live for 2 decades, now you're starting to get to that $220,000 figure. What have I not adjusted for? Inflation. That's why I think that $220,000 number is a bit misleading, right? That's kind of assuming either you both die really soon or you buy a plan that magically doesn't have its prices go up every year for the rest of your life. So, but that's kind of what you're looking at, and that's why I would say these numbers aren't made up. And the thing I would put in the back of your mind, if some of you are thinking, I'm going to save a ton of money on Part D because I'm not taking any drugs, do you need dental care? That's not built into this plan. Do you need vision care? That's not built into this plan. Do you need hearing? Do you need hearing care? That's not built into this plan. Do you want to do things that aren't covered by Medicare? Acupuncture, massage therapy, certain other forms of Eastern medicine, whatever, right? There are certainly things that you may want to do that aren't going to be covered by this. So I do believe that this is a good baseline. Not perfect for everybody, but it gives you a starting point, what to expect. Yes? Yes, but probably cost a lot less. You can get Advantage plans here in the state of Minnesota, assuming you're not a veteran, for as low as $40 a month instead of $200 a month. So that's a huge premium difference. You can get a cost plan that looks like, is not the same as, but looks like a Medicare supplement for $109. So about half the price.
Why doesn't everyone go with Advantage plans?
Here in Minnesota, over half the people do. About 25% of the people, so 100% of people, 51 or 52% in a cost or an Advantage plan, another 25% in a retiree plan. Of the remaining 25%, they're split between the Medicare supplements and no additional coverage. So really, in the state of Minnesota, it's all about cost and Advantage plans. That's the story. But there are other states where that's turned upside down. And so some people asked about states. I want to answer that states question, and then I'll come back to you. So there are 3 ways that plans can be priced. okay, whether it's a cost plan, an advantage plan, or a Medigap plan. They can be what's called community rated. That's what we do here in Minnesota. The 65-year-old pays the same as the 85-year-old, the same as the 95-year-old, the same as the 105-year-old. Everybody pays the same if they have the same plan. Community rating, okay? Second one is issue age rating. So you pay a rate based on when you buy it. So the younger you buy it, the lower the premium is. Now that premium isn't locked in for life. It will go up. But you'll pay less than somebody who waited until they were 70 to buy that same policy, okay? And the third one is attained age. So every year, your rate is adjusted, not just for inflation, but also for your age. And so in some states, if you're talking to your friends, right, who are in some of these other states, they may talk to you about how they can get a traditional Medicare supplement plan F for like $100 a month, $90 a month. You're like, wow, that's awesome. We have to pay way more than that in Minnesota. They're in a state with either issue age or attained age rating. And their rates, I promise you, because I've seen the rate charts for those states, their rates more than triple over the course of the rest of their life. If they're quick to die, they save a ton of money. But who wants to die, right? You know, if they live a long time, they're going to pay more than they would have paid in a community rated state. There's a point where it's equal, right? And so it really depends how long they're going to live, whether they get a better deal or a worse deal. But you will, from time to time, talk to friends and neighbors who have bought plans in other states, are paying very different premiums. They may think you're crazy for what you did, and you're really just working in two different systems. Here in Minnesota, by law, all the plans are community rated. They can't do those other things. And that's why it feels more expensive when you turn 65. It also feels much cheaper when you're 95. Okay. There was a question, too. Yes, so an Advantage plan is a replacement for original Medicare. You assign your Medicare benefits to the Advantage company, and the Advantage company is then writing all the rules. They're written a check every month for you, and they have to manage all your benefits and hopefully stay under that dollar amount. And if they don't, they have to dip into somebody else's money who also has that same plan, and the plan is taking the risk. A cost plan is more like a traditional supplement in that original Medicare is still responsible for its share. They're only taking risk for that top 20%. Okay? But otherwise, it's very similar to an Advantage plan. It still networks deductibles, coinsurance, copayments, out-of-pocket max, etc. Right? The big difference is they're not on the hook for the entire bill. They're only on the hook for that 20%. And that's part of why their premiums are where they are. So they were an experiment. They were a question of could private industry be more efficient at administering these benefits than the federal government. Experiment wasn't successful, but very good lobbyists kept them around. Maybe we'll do a better job when we have more members, right? And eventually they lost this argument. They said, you're not saving us any money. You're not costing us a lot more, but you don't have a lot of membership, and it's a hassle for us to deal with it, so we're just going to phase it out. That's the basic story, in short. Okay, I'll get one more and then I'm going to move on.
Do any of these benefits offer you anything outside the U.S.?
Yes, yes. So typically what you're going to get is emergency-only coverage.
Through Medicare? Or?
Not through Medicare, through your supplement. Yep. And with the supplements, it's typically 80-20 outside of the U.S. With the Advantage plans and the cost plans, it may be more generous or it may be capped. So one carrier, 100% emergency coverage out of the U.S. The rest of them, it's all capped. I'd name names, but then I'd be getting a bit too specific. I'd get myself in trouble. Okay, let's go on. I got a few more slides. So I happen to think I'm a great resource for questions on Medicare. Some of you may want to get another opinion. Here are a number of great resources for you. Some of these runs to the thousands of pages, so if you're a reader, you'll be busy. Medicare.gov, obvious one, right? Lots of resources there. Eldercare.gov, AARP.org, the SHIP plan. Every state has a state health insurance assistance program. Ours is called the Minnesota Board on Aging. They provide the senior linkage line and the healthcare choices for Minnesotans on Medicare. That's a fantastic book. We do that with our clients every day because that's what makes us objective and comprehensive. Every plan's details are in there in one place. Their pricing, their benefits, everything. Incidentally, you pay exactly the same for those plans no matter how you buy them. If you buy them direct from the company, if you use an insurance agent or broker, or if you buy it online or some other way. You're going to pay exactly the same price if you're buying exactly the same policy. There's no surcharge to have an agent. Benefits, checkup.org and socialsecurity.gov. Those are a number of fantastic resources for you. So when you're looking at this, you remember that healthcare is probably going to be one of your top 3 expenses in retirement. You're going to want to make sure that you have reliable income to cover your essential expenses, your food, your insurance, your housing, some basic transportation, whatever. If you don't have enough in reliable income sources, you're going to have to rely on other income sources, things that are more variable. This is not my area of expertise, okay? That's what real financial advisors do. I'm not a real financial advisor. I'm a health insurance agent and broker, right? I'm really good at health insurance. But this, they tell me, is something that's very important that you need to plan out. And that's what they do here very well, okay? And they can help you figure out how much do you need for the essential expenses and how are you going to get what you can't get from your fixed income sources. Remember to build inflation into that model. Okay, so basically you're grouping your insurance, or your income sources. Some of you may still have pensions. Most of us have Social Security. Some of you may have annuities. Those are things you can rely on as a general rule. Other income sources are going to have to be there to supplement if your guaranteed income streams are not large enough to meet your basic needs, and then whatever discretionary spending you have. How your advisor can help you, obviously we're going to help you check, and I'm going to be really involved in the first one, to check to make sure your health care expense estimates are accurate, that you've got a good plan that you can rely on throughout your retirement. The financial advisor will also help you bucket essential and discretionary expenses. Look at the income sources that you have for those and make sure that you're going to have enough. They can review your plan and they can develop strategies to help you adjust for any shortcomings you may have.